something happening here. But what it is ain't exactly clear. There's a man with a gun over there, telling me I got to beware. I think it's time we stop, children. What's that sound? Everybody look what's going down.
Do you know how many people, experts, do not realize what's going on in these kids' brains? They aren't thinking. And as I will try to convey, if you take away the label of autism, I would argue respectfully we're abusing your children.
1 out of every 110 babies
born today
are diagnosed with autism.
Autism.
That's an increase of 57%.
57% since 2002.
As an older physician, I take it as a personal insult that they're implying that in the 80s, before we had all these CAT scans, by the way, we had them, but before we had all this new technology, we didn't notice that these children were autistic. I mean, 60% of them don't speak, but they were walking around in the classrooms and we didn't notice it, right? And not only that, but this has been going on through all the generations, so there should be as many 50-year-old autistics as there are 30-year-old autistics as there are 10-year-old autistics. Only they can't find what's called the hidden horde. Nobody can find the 50-year-old autistics because there were so few you could count them on one hand. So that's clearly an epidemic.
To give you some perspective on this, when I was a resident, it was 1 in 10,000 children. And the latest figures are 1 in 150 children in this country have an autistic spectrum disorder.
In some of the states, like New Jersey, it's now exceeding 1 in 100. When it's all settled and everybody gets counted, the rate is going to be between 1 in 10 and 1 in 30. Certainly no lower than 1 in 50.
1 in 5 children are now in some form of special education. This is the bigger problem. These are children whose levels of poisoning may be more subtle and maybe a little bit more diminished. And these are the children that are increasing in number and a greater problem for our society, both in the educational system and the financial system. These families are running all over the place to get them to learn and speak and maintain eye contact and interact in a way that appears that they're socially and academically appropriate. This is a huge problem.
There's something that has changed in those last 2 decades that has caused the tremendous rise. It's not just us as physicians being better diagnosticians. Autism is a clinical disease. We're not necessarily better at making those types of diagnoses than we were 20 years ago. So something else has changed, and we need to look at what's changed.
Boys are much more dramatically affected than girls. Many more. 4 boys to every girl gets autism. 8 boys to every girl becomes Asperger's or some other neurological symptom.
If anybody goes into our school system today, you look everywhere. Our children learn differently. I think teachers are getting a bad rap that they're not educating our children, but our children learn totally differently than the way they used to 10 or 20 years ago. So we really have to address this issue head on. Boys are more susceptible to a lot of these environmental toxicants like mercury, and we're already seeing that girls are outpacing boys in college. They're starting classes now where they're separating girls and boys because they learn differently, and nobody's really paying attention to a lot of this, and it's hugely important. Our children just aren't healthy anymore, and we've got to ask why.
There's a common pattern happening with children with neurodevelopmental disorders, including those children who have autism, and that is that their brains are being poisoned. Their immune systems and their nervous systems are incapacitated by the degree and the intensity of the information, that is the food, the water, the air, the skincare products, the amount and intensity of stimulation through their nervous systems, and the toxins that we're delivering past their skin through injections with vaccinations. All of this information, all of this stimulation is overwhelming their immune and nervous systems, and they are being poisoned.
Autism is a disease characterized by behavioral abnormalities and symptoms. We don't have a full appreciation for what it is. We do know that it's not a psychiatric disease. It's more of a metabolic disease. a metabolic disease consisting of neurological problems associated with gastrointestinal, immune, and detoxification problems.
Autism is caused by poor mothering. That was the belief of the medical community into the late 1960s. Hi, this is Dr. Mark Hyman, and we're going to talk about autism today. The main belief of doctors today, in 2007, is that autism is a genetic brain disorder. I'm going to show you why this isn't true and why it's preventing us from getting to help so many kids who have autism and ADD. Now, how could this be a genetic disorder if the rates of autism have increased from 1 in 3,000 or more to almost 1 in 150 children today? Now, this could be from better detection rates or maybe wider criteria for diagnosis, but it can't account for the whole increase. It has to be something other than genetics. The dramatic discoveries over the last 10 to 20 years about the true causes of autism have turned our conventional thinking on its head. Now, what if I told you that autism was really a systemic body disorder that affected the brain, and that a toxic environment triggered susceptible genes that many of us have? Then this led to the behavioral problems we see in these poor children. That's actually what the current science is telling us about autism, and yet hardly anybody who's treating autism is aware of this or believes this model.
One out of every 110 babies
Born today
are diagnosed with autism.
Autism.
That's an increase of 57%.
57% since 2002.
When autism is 1% of the children, the reality is we're not really dealing with something called autism. We're dealing with a bunch of children who are ill.
He stopped speaking, he stopped looking at us, he stopped responding to his name.
You'd say it over and over, and Jacob, 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 and just no acknowledgement.
He started to become less interactive, less eye contact.
He wasn't engaging in activities that kids his age were participating in.
He was putting his hands over his ears, sensitive to sound.
He would sit in the corner and spin in a circle, or he would take a car and spin the wheels and watch the wheels spin.
He would lay on the floor and watch the wheels just go, and that's all he did.
She was kind of really in her own little world.
These children present with multiple symptoms that we were trained were medical, but somehow we're writing it all off as autism and psychological. It's impossible for a developmental or genetic disorder to ever become an epidemic, and yet we are condemning these parents and children to no future.
They're telling us all the things he's not going to be able to do in terms of having a normal, healthy, fulfilling life.
And that maybe I should look into, a group home later that he would probably never perform, independently.
His preschool teacher at the time said she questioned his ability to learn, and that was devastating, to have someone tell you that they didn't think that he would ever learn anything, and that he would be sort of stuck.
All we wanted for him is to experience some normality, have relationships with other people, connect.
People told me he would never care for anyone in the same way that other people did, and that he would never have emotional connections to other people.
The speech pathologist said, your child will never learn to love. That's a really hard pill to swallow.
I have essentially watched families go to experts around the country, go to leaders around the country, and realize that those experts, those leaders, have completely turned their back on these families. They are desperate, they need help, and that's supposed to be our job as pediatricians.
you get in this world of autism, there's 2 million people trying to sell you something or trying to push something on you to make your kid better. Jude had 9 doctors and therapy, therapy, therapy every day.
He was working 35 hours a week from age 3 till 5 doing behavior modification.
I mean, he was put through it, really put through it. It was really, really hard to watch.
It was at that time we found something on the internet about this doctor, Dr. Goldberg. He would actually do blood tests and see you know, if there's any type of medical reason for this.
If you throw out autism, then you suddenly realize we have a massive medical epidemic affecting the brains and bodies of these children. It is time we recognize that these children are ill and have autistic-like symptoms, but do not have autism.
Call it what you want.
Call it what you want.
Call it what you want.
But don't call it autism.
But don't call it autism.
But don't call it autism.
We were reserved. We weren't sure what to believe because this was probably the 15th or 16th thing that we have tried. And after about 2 weeks, it was like he gained a year.
Month after month, he was able to do more things.
And one day he opened his mouth and he had, within a week, a 2,000-word vocabulary.
My son got straight A's in junior high, wants to go to MIT. He's incredibly smart.
He says he loves me. Mommy, I love you. Gives me hugs and kisses.
I remember calling my friend Maria and going, guess what? You're never going to believe it. And it was like a final breakthrough because all of a sudden I had a connection with my daughter. I thought, yes, she's feeling that emotion. She's getting it. She's connecting. And that was huge. It was huge.
I no longer had that doubt that he's going to be able to take care of himself. He has a future now.
If you knew what we've gone through to get to this moment, and I was very excited.
I just pray that other people will have the same hope because it's just not reserved for our family.
There is hope. There's hope.
There is hope.
You better stop. Hey, what's that sound? Everybody look what's going. You better stop. Hey, what's that sound? Everybody look what's going. You better stop now. What's that sound?